Before getting started with this video presentation, please take a moment, pause if you need to read the disclaimer on the screen. In this video, I am going to be doing a brief presentation on the indicators of traumatic stress and violence, and this is going to be relevant to answering questions on the ASWB exam in regards to being able to assess these things when you have questions on the exam that are requiring you to assess and how to clinically intervene with individuals who may be experiencing some type of stress or violence or anything of the like. To begin, know that stress is a typical response to feeling overwhelmed or threatened. And trauma is when a client experiences neurological distress that does not go away, or when he or she is not able to return to a state of equilibrium. Or some indicators of traumatic stress and violence. This is going to come into play when you are answering assessment questions. You will need to know what this looks like. If the question gives you any of these symptoms or signs in the vignette, then you will know that this client is experiencing stress or violence or anything like that. So some of the indicators are addictive behaviors related to drugs, alcohol, sex, shopping, and gambling. So anything impulsive like that. An inability to tolerate conflicts with others or intense feelings. This is how you know that someone is experiencing or has experienced some traumatic stress or violence in their life. A belief of being bad, worthless, without value, or importance. Again, these are indicators that someone is experiencing or has experienced traumatic stress or violence. Dichotomous or all or nothing thinking, okay? So it's just either one way or the other way. There's no gray area. There's nothing in between. Chronic and repeated suicidal thoughts or feelings. Poor attachment. Disassociation. So we know that disassociation is usually always related to some type of trauma. Eating disorders such as anorexia, bulimia, and obesity can also be indicators of traumatic stress. Self-blame, intense anxiety and repeated panic attacks, depression, self-harm, self-mutilation, self-injury, or self-destruction, and unexplained but intense fears of people, places, or things. So these phobias as well could be that these clients have experienced some type of traumatic stress in their past. So just be looking for these indicators in the vignettes whenever they're asking you questions, specifically these assessment questions. Some indicators of trauma or violence during childhood. So this is very important to pay attention to for children. This may be the results of, this may be indicators, but just know that if you see some of these things in a vignette, that trauma or violence is likely present. So children may have problems regulating their behaviors and their emotions. They may be clingy and fearful of new situations, easily frightened, difficult to console, aggressive, impulsive, sleepless, delayed in developmental milestones, and or regressing in functioning and behavior. These are indicators that these children are under traumatic stress or experiencing some type of violence in their lives. This could also be, let me just interject and say, this could also be that they have been seeing violence, not just experiencing it for themselves, but if they're in a home with domestic violence, this can also be indicators of that as well. Social workers must often work with clients to address the underlying emotional impacts of the trauma in order for clients to make behavioral changes. Clients who experience trauma often believe that they cannot trust, the world is not safe, and they are powerless to change their circumstances. Beliefs about themselves, others, and the world diminish their sense of competency. So knowing that when you are assessing for trauma, you have to pay attention to these specific behaviors. So remember that trauma is the response that a client has to an extremely negative event. So one of the most common reactions that people have to trauma is emotional reactions. And these are the common effects of trauma. Impacts of trauma on the client self-image include, but are not limited to, anxiety, denial, agitation, irritability, or rage. Flashbacks or intrusive memories. Again, this can be very much so tied to trauma, and I've seen a few exam questions regarding clients having flashbacks. Feeling disconnected from the world. Again, disassociation related to trauma. Unrest in certain situations. Being shut down. Being very passive. Feeling depressed. Guilt, shame, self-blame. Unusual fears, impatience. Having a hard time concentrating, wanting to hurt oneself, being unable to trust anyone, feeling unlikable, and feeling unsafe. These are the things that you want to assess for when you are assessing for trauma. These are very important emotional reactions that we are assessing for. So on the exam, if they are giving you any of the indicators that was mentioned in the previous slide, these are the things you're going to assess for. See if they feel safe. See if they are having flashbacks, or if they give you in the vignette things talking about this client is feeling disconnected from themselves or the world, having flashbacks, having a hard time concentrating, want to hurt oneself. These are ways that you can assess to see if the client is having an emotional reaction to a traumatic experience. Who have experienced trauma may display intense emotion towards others, such as friends or family members. Clients can also emotionally retreat from these individuals, choosing to isolate themselves. Thus, trauma can be difficult for those who are close to clients as well. So family members or close friends may begin to start feeling rejected if this client is experiencing trauma and they choose to take their emotions out on them or isolate themselves. So here are some behavioral manifestations of trauma: insomnia or fatigue, using harmful substances, keeping to oneself, overworking. Y'all, overworking can be tied to trauma, trying to keep their mind busy and distracted. Eating problems, lethargy, drug or alcohol use, needing to do certain things over and over again. So having these compulsions, always having to have things a certain way, and doing strange or risky things. Okay, so these are all the behavioral manifestations of trauma. Now we've already assessed some of the emotional reactions. Now here are the behavioral reactions of trauma. Situations where a client is seen to be a danger to themselves or others, a social worker may limit a client's right to self-determination and seek involuntary treatment, such as commitment to an inpatient setting. If a client is deemed to be a danger to an identifiable third party, a social worker should consider this as a duty to warn situation, as well as the party in danger. Okay, so just knowing that if the client wants to hurt themselves or someone else, you are a mandated reporter to report that. So here are some risk factors of clients that could be a danger to themselves. They have a history of previous suicide attempts. So I have that bolded, y'all, because that is the best predictor of a future attempt. If they've already tried in the past, then they are at a higher risk for attempting again. Medical seriousness of the attempt is also significant. They live alone. They lack social supports. They have a presence of psychiatric disorders like depression, anxiety, some type of personality disorder. A client is also at greater risk after being discharged from the hospital or after being started on antidepressants, as he or she may now have the energy to implement a suicide plan. So y'all, these clients that are being released from these psychiatric hospitals, they are also at greater risk, especially if these clients are there because of depression, suicidal attempts, or anything like that. Now they are feeling better, so when they leave out, now they have more energy. Their mindset is a little bit more clear, and so they may consider going forward again. So we want to make sure that we are discharging them with a good outpatient plan for this reason. Substance abuse, family, close friend, or history of suicide. So if there is a family member or a close friend that has a history of suicide, that has died by suicide, this is also a risk factor for this client. I know sometimes I've heard people say that they would think it would be the opposite if they've lost someone who's died by suicide. That would kind of make them not want to. You would think they would be on the opposite end of the spectrum, but it's actually not. They are at a higher risk when they have experienced loss by suicide. Exposure to suicidal behavior of others through media or peers. So if they're being influenced by what they watch and they've seen videos and other negative things talking about suicide and things like that, this is putting this in their mind and in their spirit. So that puts them at a greater risk. Losses. So that can include a relationship, job, financial, friends, anything like that. So experiencing losses can also put a person at greater risk for suicide. And having the presence of a firearm or easy access to other lethal methods. That even includes medication, y'all. So having access to this will put someone at a higher risk to be able to complete the act of suicide. So these are all things, these are all risk factors, especially when we are conducting a suicide risk assessment, that we want to pay attention to. Even more importantly, here are some behavioral warning signs that will let you know that this person is possibly contemplating suicide. If they have a change in their eating and sleeping habits, drug and alcohol use, unusual neglect of personal appearance, marked personality change, loss of interest in pleasurable activities, not tolerating praise or rewards, giving away belongings. That's a big one. They want to all of a sudden give away their dog or give away the special necklace that their mom gave them before she passed away. Giving away their prized possessions is a big one. Isolated from others, taking care of legal and other issues. So trying to get all their legal issues, their legal matters and financial matters in order could be another sign. And dramatic increase in mood. So this might indicate a client has made a decision to end his or her life. So again, on the exam, if you are seeing any of this in the scenarios, the first thing I want you to think of is suicide risk assessment, because if they said that they had a change in their eating and sleeping habits, they're depressed and all things like that, any signs, clear signs of depression or anything like that. And so there are also some statements that we can be aware of what our client says, and sometimes they will verbatimly put them on the exam so that you would know to consider safety first, to conduct a suicide risk assessment, to get this client the help that they need. So verbalizing threats to commit suicide or feelings of despair and hopelessness is probably one of the biggest and most important behavioral warning signs. So saying things like, I'm going to kill myself. I wish I were dead. My family would be better off without me. The only way out for me is to die. It's just too much for me to put up with. Nobody needs me anymore. I don't know how much longer I can deal with this. So statements that are like that or direct indications that this person could be contemplating suicide. So you do that risk assessment and you prioritize their safety. If the way they answer these questions leans more towards yes, they are having these suicidal ideations, then we want to automatically go into safety mode and get these clients help. So I want to point out, a lot of people are confused about when to create a safety plan. One of the simplest ways that I think about it is, if there's a risk, you want to create a safety plan. If there is a plan, it is too late for you to create a safety plan. It's time for you to act. If they already have a plan, it's time for you to act. So risk would include things like depression with no suicidal ideation, okay, or discharging them from a hospital, like we spoke about a few slides earlier, discharging them with a safety plan just in case they start to feel depressed or start to have those thoughts again. Things like that, having a good discharge plan, having some outpatient things set up for them. So these are instances where you would want to create a safety plan when there's a possible risk, okay? But when there is an imminent risk, to where this client has a plan, this client is like, I'm gonna go home and take all my sleeping pills, I just don't want to do this no more. If they, especially if they verbalize it, or any of these statements are verbalized, then we don't want to create a safety plan, because now it's already sounding like, their mind is made up. So we definitely don't want to do that. Here we're going to just talk about violence a little bit, danger to others, which is violence, and some behavioral warning signs for you to notice to know if your client is experiencing violence or abuse of anything like that. So we know drug and alcohol use is a good sign of behavioral violence towards other people. Marked personality changes, angry outbursts, preoccupation with killing, war, violence, and weapons. So if somebody comes and all they, are preoccupied is just with killings that's going on, and just want to talk about guns all the time. Isolation from others, obtaining guns and other lethal methods. These are all indicators that this person is being violent, or is at risk for displaying some type of violence in children. Bullying starting before the age of 13 is a big sign. Involvement with delinquent peers and gang members are two of the most powerful predictors of violence. And also, if a child got into like a lot of like violent trouble before the age of 13, that's a good indicator also, that they could take these behaviors into adulthood. So, and just remember, gang membership and all of that, and just hanging out with the wrong people, those are the most powerful predictors of violence. So just look for these signs as well. These angry outbursts just with anyone for any reason will be an indication of violence. And remember that we've already talked about some of the signs when someone is experiencing violence. So on the other hand, some of these symptoms are the same, isolated from others and things like that. So just know how to assess for the difference between someone who is being abused and someone who is an abuser. This is also going to be important for you to know for the ASWB exam. Y'all know I appreciate y'all being here. For more study and practice materials, you can visit the website. There we have practice exams, practice questions. You can do mock exams. You can do questions just by unit. So if you just wanted unit 1 practice questions, all you do is hover over the link, and a drop down menu will come and you select those unit 1 questions. Same thing for units 2, 3, 4, as well as community has its own separate area for just specific community questions, or you can do all the units, or you can get an entire mock exam. It's totally up to you. We do offer individual topical study guides that are printed and mailed, which usually takes up to about 5 business days from the time that they were shipped to get to you. So we have a ton of resources to help you pass this exam, and our main resource being our online prep course that a lot of our clients are raving about, that is just basically taking you through this material topic by topic, giving you a lot of practice questions and quizzes, and just making sure you have everything you need for this exam. And taking it a step further, I do offer live individual as well as group sessions. So you can also visit the website to schedule a session, whether you want it to be live, individual, or a group. I do a quick group session every Friday. It's a 30-minute session. It's a group session, so we practice there. And then every other Monday, we do a 1.5-hour live group session, and those are really, really beneficial along with the individual sessions. You must book an initial session first, and then we go into follow-up supplemental sessions after that. But there is a plethora of resources on the website. Also, if you're not following us on Facebook, you're missing out on one of the greatest social work prep groups that is on social media. So please follow us on Facebook and also join the Savvy Social Worker Exam Prep group. Follow us on Instagram as well as TikTok. We are going to be doing some giveaways this year. I've already given away the course to many people. They've won the course in different types of ways, so just stay tuned for that. Again, like this video, share this video. I hope it was helpful, and if you're not subscribed to the channel, please do so now. Thank y'all, and let's continue to get those passes the Savvy way.